All right, good morning to everyone. Welcome to the 7th annual Columbus Parkinson's Retreat. This is fantastic. Dr. Hinkle said there'd be a bunch of you. He didn't say you'd be so good looking. Oh, nice. On behalf of OhioHealth and 5K for JK, we'd like to welcome you. Thank you for coming. This is the PD 101 session, which means we might have some newbies in the room. I once sat where you're sitting. And what I can tell you, what you're doing right now is going to be hugely beneficial to you. Patients need to meet other patients. Care partners need to meet other care partners. And we all need to arm ourselves with great information about Parkinson's. My name's Matthew Moore, and I'm a YOPD patient, meaning I was diagnosed in 2019 at the age of 49. My main symptoms have been hair loss and weight gain. That's a joke. That's no, not really. I have written some stand-up comedy about Parkinson's and a play about Parkinson's, which we hope will be made into a movie about Parkinson's, which would be the first ever full-length narrative film about Parkinson's. And that would be awesome. We hope to shoot it here in Columbus, and we hope to call you, because we need some crowd scenes with people with Parkinson's. But enough about that. Today we're going to start off, as we should, with Dr. Hinkle.
Well, I've got the weight gain going, so maybe I'm on my way. So I'm Dave Hinkle. I'm a movement disorders neurologist at OhioHealth. Thanks for coming. I know it's a little early and it's a little chilly in here. We're going to the format for this year's event, we're going to talk a little bit of science, talk a little bit of exercise wellness, and then talk a little bit about what scientists are working on to try to do a better job than we're doing now. So I'm going to start off. I've actually got two talks in a row that will blend into each other. I'm going to talk about, that's welcome. Thank you so much again for coming. I'm going to do an overview of some of the science, some of the biochemistry that will be a basis for what talk about a little bit later in the session. And so, sorry to start with biochemistry so early in the morning, but that's where this is. Molecules need to be shaped in normally to function normally. And so two molecules here that have structures that interact, they'll interact and have a normal function. However, if something happens that modifies the shape of a protein or another molecule, it may no longer fit with its conjugate partner, and this can cause either a loss of normal function or a gain of an abnormal toxic function. Okay? So abnormally shaped alpha-synuclein protein is toxic to brain cells, and this is one of the key sources, we think, of the development of Parkinson's disease. So normal alpha-synuclein, three-dimensional structure, allows it to function normally. And what happens is processes within the brain cells will cause the protein to change into an abnormal structure, and these processes involve something called oxidative stress, where oxygen molecules will become reactive, interact with proteins, other molecules, change them and morph their shape. Also processes of inflammation, and in the brain, particularly neuroinflammation. So these are kind of two of the main sources of problems and the main focuses of research in terms of disease-modifying therapies. And both of these processes will stimulate misfolding of this alpha-synuclein protein. What we'd really like to know is, why does this start? What happens in the early Parkinson's brain, excuse me, that stimulates these processes that ultimately stimulates the misfolding of the proteins. What happens is that when these proteins are misfolded, they become sticky. And they stick together and they will also glom onto normally folded alpha-synuclein protein and stimulate the protein to change into an abnormal structure. And then they kind of aggregate together into bigger and bigger and bigger and bigger molecule aggregates. The trash basically builds up in the cell, starts to choke off the functioning of the cell. The trash is kind of put in a container which is called a Lewy body, which I'm sure you've heard of. Dr. Lewy, 100 and so years ago, saw these little nuggets in cells, and so I've got an arrow pointing to it. This shouldn't be there, but alpha-synuclein is actually the major component of the Lewy body. The aggregation of these alpha-synuclein proteins also stimulates oxidative stress pathology and inflammation pathology. This then kind of feeds back to the very beginning to kind of feed forward on changes of the normal structure into abnormal structures. But also these processes of oxidative stress and inflammation will eventually overwhelm a cell and start to kill it. In addition, these big, long, sticky aggregates of abnormal protein will kind of chunk off, break up, and seed. The seeds will stimulate more and more of this misfolding and stickiness of the protein. Probably about 15 years ago, it was identified that these seeds of alpha-synuclein protein that form in cells will actually go from cell to cell. So the pathology will go to neighboring cells that are healthy, and the pathology will also spread down the line in the circuit. So Parkinson's, we think, actually will kind of spread from cell to cell. So this goes back 20-some years. A pathologist in Germany looked at brain sections and found a clear pattern of progression starting on your left. I don't have a pointer, so I'll have to talk. On your left side, kind of low in the brain stem, the pathology develops there with alpha-synuclein aggregation and accumulation. As Parkinson's advances, and probably because of this, alpha-synuclein will kind of spread up into the upper brain stem and then into the brain as a whole. And the areas that started the pathology also get kind of worse and worse and worse over time. So there are multiple aspects of science that show this progression of the pathology of alpha-synuclein accumulation. We now kind of talk about different stages of Parkinson's disease in terms of prodromal, early, late. It's not critical. Staging is not really very precise. But in the early stages of Parkinson's disease, even pre-diagnosis, probably for 5, 10, 15 years before a person is actually clinically diagnosed, people will oftentimes have features that are based on pre-motor or movement pathology. So REM behavior disorder, I have really vivid dreams, I act out the dreams, punch out, yell out, disrupts my sleep. Smell changes, loss of smell in particular. Mood changes, I'm a little more prone to being anxious, I'm a little more prone to being depressed, I'm a little more prone to being frustrated or angry. What's going on? Constipation, the gut kind of slows down, water absorption stays the same, stool gets a little dry and a little tough to pass. And you'll see your doctor and he or she will say, well, you're just getting older, not really sure what's going on. And then as the pathology spreads up into the upper part of the brainstem there, hitting dopamine cells, the clinical features that allow diagnosis start to develop. Tremor, which is shaking, bradykinesia, which is a two-component issue, slow movement and reduced size or amplitude of movement, and rigidity of the muscle tone, tightness of the muscle tone. When we can see these features on examination, we can make a definitive clinical diagnosis of Parkinson's disease. Prodromal features, of course, still can be present. And just FYI, not everybody has everything, so this is not a list of what's going to happen. And none of my talks are a list of what's going to happen. It's possibilities. And I've never seen anybody with every clinical feature that I'll talk about. Whoops. So the pathology of tremor, stiffness, slowness actually occurs in a small area deep in the brain stem. This is a slice this way of the brain. And the arrows are pointing to an area called the substantia nigra, which is where the dopamine cells are. And in fact, the cells that are having trouble are in a sub-region of this area of the brain, about the size of a piece of cooked rice, believe it or not. So that's the big trouble spot for these tremor, stiffness, slowness features. As Parkinson's moves further along, the current features continue. People may develop cognitive problems. People may develop walking problems. And again, not everybody gets this far in. Kind of depends on survival of that person, timing of the onset. But this is a typical progression of Parkinson's disease, and based on the pathology of alpha-synuclein spreading through the brain. The brain's not stupid. The brain's actually smarter than we are, and it does try to protect itself against what's going on. And again, we've got these normal alpha-synuclein proteins that become misfolded and sticky and kind of build up in the brain. We have lots of detective systems within the brain that can identify when proteins or other molecules are changed in structure and become either toxic or non-functional, and these mechanisms can kind of tag them and then pull them out of the system. So one of the systems involved is actually kind of an acid pit called lysosomes, where misfolded proteins are actually taken there, put in the bucket, digested away by acid to get rid of the misfolded non-functioning proteins. And then there are also structures called proteasomes that literally shred up those misfolded molecules. One of the components of Parkinson's, however, is that these oxidative stress mechanisms, these neuroinflammatory mechanisms, will reduce or block the function of the lysosomes, the acid pits, the proteasomes, the shredders, to make them less effective so that these proteins can continue to build up and cause trouble.